Hello and welcome. My name is Daniel Walker, and unfortunately today, everybody knows about COVID-19. But nurses and other staff in the medical field have had their workload double since the beginning of March. As a student who's majoring in nursing, I will be informing you today about a few things that nurses do, some statistics involving nursing during recession, and some specialties that a nurse can branch out to. According to the BetterTeam.com website, the job description of a nurse are as follows: monitoring patients, administration of medication, keeping records, consulting with healthcare professionals, advising of the patients after care, and doing loads of paperwork. A nurse is the person you see before your short visit with the doctor. In an emergency situation, nurses provide insight to your diagnosis before your doctor sees you on the sole purpose to save time. For example, if 10 patients were to go into a hospital and only 3 of those patients needed life-saving surgery, then the several nurses will be able to find out who needs the surgery in a timely manner compared to the amount of time it would take the shorter amount of doctors. The nurses are sort of like expo workers in a restaurant, not to compare people to food, but organizing the food and making sure it goes to the right table is sort of like what a nurse does with human beings. Definitely expect time to interfere as a nurse in this case. The next topic I would like to discuss is the rate at which nurses are hired and fired and the demand that there is for nurses. According to the U.S. Bureau of Labor Statistics, the job outlook on nursing is projected to grow 7% from 2019 to 2029 with today's Great Recession enveloped, for a number of reasons as well. Employment has remained for registered nurses during the recession caused by COVID, and the unemployment rate was at 15% from 4% in April of this year. This information proves the statement that nursing is recession-proof. There will always be a need for medical staff in any event given today in the world. Lastly, I'm going to explain what one can do with a nursing license and where one can specialize with a nursing license. According to Health Leaders U.S. by Florida Today, in 2009, 4% of the 36,000 nurses did not work in the occupation of nursing, and a mere 12% did not work at all. Some have become product developers, consultants, teachers, authors, and many different occupations. According to the staff writers at Nurse Journal, there are upwards of 50 different things you can do with a nursing license and degree, some of the most popular being becoming a case manager for nurses on the floor, so organizing different needs for patients for the nurses that are working on the floor with them. Becoming a midwife nurse, delivering babies with the OBGYN. Becoming a prison nurse, a school nurse, a long-term care nurse, a pediatric nurse for children, a pharmaceutical nurse, nurse for drugs, and a public health nurse, so your clinics, and many, many more. A hospice nurse is another popular one. The list goes on. Nursing is a versatile field that specializes in high-quality patient care in many different settings. As of lately, the well-being of nurses is being examined. To the academic journal Nurse Leader, there's a study showing the burnout rate of nurses and the link between nursing and depression. Nurses are being monitored during the pandemic to visualize the effects of their workload. Nursing is characterized as recession-proof, somewhat laborsome, and versatile. In today's medical climate, there's no number that would take medical staff from scarce to well-staffed. I hope today that you learned something the way I did about nurses, and please treat your nurses kindly. They are under immense pressure, and they could use your support. Thank you.